I'd like to welcome to the stage the President of the University of Minnesota, Dr. Rebecca Cunningham.
Good evening, everyone. I'm Rebecca Cunningham, President of the University of Minnesota. I'm just thrilled to join you here tonight. I'm now halfway through my first year as your university president, and I continue to be struck by the power and prestige of our research enterprise at the University of Minnesota. The knowledge, innovations, and discoveries we generate every single day are not confined within the research lab. They are translated out into the community, into the economy in ways that benefit our society. Look no further than our work in the MedTech space. From our Visible Heart Lab, which was developed in partnership with Medtronic, to our Bakken Medical Devices Center Innovation Fellows program, which is training the next generation of leaders in MedTech. The interplay between patients, clinicians, scientists, and engineers has uniquely positioned the University of Minnesota and our state as global leaders in MedTech. Having spent most of my career at the intersection of clinical care and technological interventions, I've always had a deep affinity for MedTech. Now, we have a unique opportunity to build on our strong momentum in this space through Minnesota MedTech 3.0. This shared strategy, led by Greater MSP, harnesses the knowledge and experience from the University of Minnesota, as well as leading organizations like Medtronic and Mayo Clinic, Governor Walz and the state of Minnesota, Medical Alley, and countless other MedTech leaders, health systems, and insurers. Minnesota MedTech is uniting institutions and leaders around a shared agenda to position Minnesota as a global center for smart MedTech by integrating AI, machine learning, and data science. We're all working together to support innovators, to strengthen our infrastructure, to train the world's most skilled workforce, and to market Minnesota to key global audiences. But why is it so important to the University of Minnesota and our state? By coming together to support and advance MedTech, we can deliver better healthcare outcomes for patients around the world. We can strengthen our healthcare system, and we can drive statewide economic impact and growth, creating new opportunities for Minnesotans across all 87 counties. I referenced our momentum in this space, which is illustrated by our designation as America's tech hub for smart medical technology. This designation opens up new opportunities for federal support to accelerate innovation and discovery. We are all united under one big umbrella to advance the strategy we've developed together. To help seize our opportunity in this space, Jim Southwick was recently hired to serve as the inaugural Managing Director of Minnesota MedTech 3.0. Jim will be working with leaders like myself, Governor Walz, Jeff Martha at Medtronic, Dr. Faruja at Mayo Clinic, Andrea Walsh at Health Partners, and scores of others to realize our vision for Minnesota. So what's next for MedTech 3.0? Team Minnesota is working hard to ensure our state is the first place a MedTech company thinks about when it wants to grow and expand its operations, whether they are a new startup or a global leader. Minnesota MedTech 3.0 partners are launching an inaugural cohort of startups that we are wrapping our arms around to support their growth. At the same time, the governor is proposing new tools that will help us win more global expansions of incumbent leaders. We are also launching the North Star Data Alliance to ensure Minnesota is the global destination for innovators to access health data they need to build new solutions. On the talent front, we have two new major initiatives underway. The MicroWorks partnership is uniting the state's microelectronics employers and its workforce system. And an innovative partnership is uniting the state's leading healthcare systems. Together, these two groups have identified key occupations that can employ thousands more Minnesotans in good jobs. And they're working together to engage higher ed and other organizations in interventions that can transform how we pull more Minnesotans into ladders of opportunity. Minnesota is poised to elevate its reputation as a global leader in MedTech. We already have more than 36,000 people in MSP in this region who work in MedTech, which is more than any other metro area in the country outside of LA. Wow. That's right. These jobs pay above median wages, and more than half of them are accessible to workers with a high school degree. Given how, that's right, yep. Given how our medical devices are exported across the world, each job in this sector brings in money that has positive ripple effects across our economy. It's an exciting time to be a Minnesotan. I look forward to partnering with you and your colleagues so that together we can push the boundaries of MedTech for the betterment of our people and our communities. Thank you so much.